Era is currently attached to the WHO Country Office after serving as the Deputy Director General of Public Health Services and Director Policy and Planning, a pioneering architect of the primary healthcare cluster model in Sri Lanka. She was a past president of the College of Community Physicians of Sri Lanka. Here is fabulous Susie Madam to speak to us. Ladies and gentlemen, a round of applause.
Thank you, Santusha. I don't know whether I'm going to be glamorous or humorous or whatever. But certainly, I think I was asked to do this topic and then was asked to also talk about colonial period, and then I was asked by Dr. Sujatha to talk about Emani. So I was like really confused and as to how to pitch this. So, and to also relate stories, right? Otherwise it can be a little boring, right? So, the key point here is about the political leadership, but we really need to understand. So this is my little diagrams. I have a habit of doing this, and once Professor Gurita Fernando, whom I trained under, she and I share this habit of drawing conceptual, all these diagrams, and it worked well because an academic as she was, and for me being more practice, so these diagrams really helped. And to date, I have a whole array of these kind of diagrams, and that has really helped me as well as how I convey it to others. So that's something that I have built on. So in this whole business of policy, the important part that a lot of people forget is that we think it's, okay, the Ministry of Health driving something. But it's the people, it's the professionals, it's the political opinion, but the lead agency can be the ministry, not always the ministry. So there's an issue and context. This is something that I have kind of come to understand over the years in I've been involved in different policy processes. In all of these, I came to understand the issue and the context is what is changing. And Dr. Sujatha wanted me to relate to M&E. So let's see whether I can relate that in a story. So colonial rule, as you know, was all this, and Portuguese didn't really. We don't hear of many contributions to health development during the Portuguese era, but the Dutch, we have the Dutch hospital, and they were mainly looking after their concerns, and they built the facilities to really look after their people. And of course, British era, we had many changes which to date we are benefiting from. This is the drawing of the Dutch hospital, which might interest you, I think. Dr. Margaret Jones, I first met her, actually, I was invited by the University of York on global health histories. They were interested at that time of the work that I was doing on primary healthcare changes when I was at the planning unit and as director policy. She came and met me. We had a lot of discussions. Subsequently, they invited me to the World Health Assembly to do a joint side event. So that was probably the first side event at the World Health Assembly where Sri Lanka participated. And this is actually just a description of the book, and I didn't really capture the chapter in. I was also, only now I remember actually, the same book I was also, I had a chapter in the same book. But read the second paragraph. So in the British colonial era, towards the latter part of the 1800s, actually, when most of our doctors were going to India to be trained, the late 1800s, the Colombo Medical Faculty, medical school was started. And that became a landmark and the oldest faculty, the second oldest in South Asia. And Margaret Jones writes that the people who came from this faculty, the oldest faculty, were the ones actually who helped the system develop at that time in the early 1900s. And of course, previously they were going to the Bengal University in India. So, despite the work going on in the form of health services, if you take what happened in the 1900s, the plantation sector was facing a huge problem, and the whole of Sri Lanka also had effects due to the hookworm infestation. And it was really, if you go back to my little conceptual diagram, it was really the plantation sector who reached out to the European civil society, inviting them to do something, and that was the Rockefeller Foundation. So they came and looked at the hookworm infestation part in the plantation sector, but really couldn't solve that. Right? There were treatments and wide-scale medications done, but